So the ALCAT test is a specialized test looking for food sensitivities. And that's a term that maybe needs a little bit of definition. But when you consume any food, reactions can happen. Number one, you can have an allergic reaction. The allergic reaction is immune mediated. You typically had to have seen that before, and it can be hives and swelling or a rash or even tenderness or ticklishness in the throat. You can eat a food that you don't digest well. You're not allergic to it, but it causes indigestion, and that means it's going to cause you to either belch or burp or have some bloating or gas or changes in your bowel movements. Okay, the classic food intolerance for digestion is milk. So milk sugar is called lactose, and as we grow up, sometimes we become sensitive to that product. We eat the milk and it causes gas and bloating. Most people when they're younger don't have a problem with that because their body makes that enzyme called lactase to help you digest milk. But as we become teenagers and young adults, sometimes the ability to digest milk products go down, and then people eat that product and they get some indigestion. Now the third one besides allergy and indigestion is sensitivity, meaning you can take that food in and it doesn't cause an allergic reaction. You can take that food in and it doesn't cause indigestion, but it might cause inflammation. It may cause some swelling or pain or disruption of normal function because your body is sensitive to it. This is classic of a group called the Nightshades. Nightshades are plants that grow well at night. Peppers and tomatoes and potatoes. So those foods cause joint inflammation in some people, and by removing them, you're sensitive to them, you may have less joint pain. The ALCAT test checks for a couple hundred food sensitivities to give people a personalized approach to what foods they should be avoiding and what foods they should be eating. So when patients have had vague symptoms or symptoms that are not attributable to any one cause, I always look at what we're eating, because some of the foods we're eating on a regular basis can really affect our health. Some people are aware of this and they realize, hey, I got to stop eating this wheat or stop eating this dairy because when I eat it, it makes me feel worse. But what about chicken or broccoli? Could those foods cause some inflammation or symptoms? So one of the main processes without doing lab tests is called an elimination rotation diet, where you take a food like wheat or dairy or corn or peanuts or even chicken and broccoli, and per 1 week you take that food out and you see if any of your symptoms resolve, and then after that week you put it back in your diet and see if the symptoms resurge. That's very often when people realize, oh, now I see, when I avoid dairy I didn't feel that much better, but when I added it back in, boy, I got all the symptoms again. So the ALCAT test is an amazing blood test that checks for 250 or so foods, which would take the better part of 250 weeks to test. And so it really gives people a roadmap on what foods that they maybe don't eat on a regular basis. The easiest thing for you to do is to look at foods that you're eating every day. If you're drawn to or crave certain foods, those are the first things to try a week without, and try to rotate them out, eliminate them for a week, and put them back in after a week to see if they make a difference on how you feel.